Hi, and welcome back to the PPC's Research in Brief. I'm Natalie Leathers, a media intern for the center, and today I'm joined by Natoshia Askelson, Senior Research Fellow in the Health Policy Research Program and Associate Professor in the Department of Community and Behavioral Health. Thank you for joining me.
Happy to be here.
So, tell us a little bit about your role at the PPC.
So as you mentioned, I'm a senior research fellow, which actually means I've just been here for a really long time. I looked back and I've been at this TBC since 2004. As part of that, I'm in the health policy group. And I have been fortunate to have been a researcher on a lot of the mixed method studies. I have expertise in qualitative data collection and interpretation, and so have been able to provide that skill to work with the PPC. And I have expertise in understanding people's behavior and behavior change. And so I've been able to use that lens in looking at the research that we do.
Awesome. So what is your current research focusing on, and what sorts of different projects are you working on right now?
So at the Public Policy Center, my current research focuses on the Healthy Behaviors Incentive Program. I'm the co-lead for the evaluation of that Medicaid expansion program. It's a program that encourages people to do a well visit and a risk assessment so that they do not have to pay a premium for their Medicaid coverage. And we're trying to understand, are people aware of the program? Do they understand the different components of the program? Are they doing the two behaviors, the well visit and the health risk assessment, in order to avoid having to pay for the premium? If they are paying the premium because they didn't do those two behaviors, how is that working for them? And then if they're not paying the premium and they didn't do the two behaviors, then they end up being disenrolled from the program. And so we're trying to understand what happens when people get disenrolled and they lose their Medicaid coverage. So, are they able to find other insurance? Are they without insurance? Are they not being able to see the doctor, not get their prescriptions filled, those kinds of things. It's a really interesting evaluation because we're able to look at both the claims data in Medicaid. So we're able to actually look at, are people going to the doctor? Are they getting their prescriptions filled? Are they going to the hospital? And we're also able to couple that with survey research. So we're actually able to document people's actual experiences, their attitudes, their knowledge, their awareness of the program. What are some of the barriers that prevent them from doing the behaviors that they're supposed to be doing? What might be some of the things that facilitate or factors that help them get those behaviors done? And what do they understand about the program? So it's been a really nice mix to be able to look at administrative data and survey data. And we will be going on to do some interviews as well, so we can really gather people's stories and their narratives around what it's like to be in this program.
Awesome. What are some of your more long-term research goals?
So I spend a lot of time thinking about behavior and thinking about how to make the healthy thing and the right thing, the easy thing to do for people. We all know what a struggle it is to, eat the right foods, get enough physical activity, get all of our shots when we're supposed to, go get all our cancer screenings. And so whatever we can do to make it easier for people, they're more likely to accomplish it. So previously, there's been a lot of focus on individual behavior and how do you change an individual's behavior. So how do you provide them with the skills they need so that they, can cook healthy food? Or how do you teach them about the kinds of physical activity they need to be doing in order to stay healthy? But if we look at policy, we're able to move big groups of people in ways that people might not even realize, or ways that don't require so much effort. So for example, the seatbelt law, which for some folks remember a time when seatbelts were not required, and you had to try to individually convince every person to wear a seatbelt. Well, now we have a law that basically says you got to wear a seatbelt, otherwise you're going to suffer consequences. And that made it a lot easier for people to just decide, click it or get a ticket, and they clicked it. So that we can do the same kind of things with fresh fruits and vegetables, right? We can make fresh fruits and vegetables. We can pass laws and have programs that incentivize people to eat fresh fruits and vegetables. So they don't have to decide, do I buy a frozen pizza or do I buy those blueberries? Like they can buy those blueberries, they're cheaper, they're easier to prepare than the frozen pizza. They're ready to eat right away. And so I spend a lot of time thinking about how do we change policies? How do we develop programs that really make it easy for people to do the healthy and the right thing?
Awesome. That's all of the questions that we had, but do you have any last thoughts or like any final things to say about your research?
I don't know if I have anything to say my research, but I mean, the Public Policy Center is this great place where we're really interdisciplinary and you really can feed off of the different work people do because someone in criminology might view the problem differently than someone in public health than someone who's in the College of Business. And together, like we come up with really creative and interesting solutions and ideas. And so that's a really like unique and innovative part of being part of the Public Policy Center.
Thanks, Natasha, for joining me on this episode of Research in Brief. I'm Natalie Leathers. We'll see you next time.